So I grew up in southern part of New York State in a region called the Hudson Valley, and I primarily did all of my training, college, medical school, all of those kinds of things in the Northeast. I specifically went to medical school at SUNY Upstate Medical University, which is in Syracuse, New York. So when I was young, my grandfather was living with us and he had a medical emergency. And I remember feeling really helpless in that moment, not knowing how to help him. And so it was at that moment that I decided that I wanted to go into medicine so that if I was ever in that situation again, I'd be able to help the person in front of me. I do pediatric gastroenterology because of a patient that I met when I was in training. I just loved hearing his story and interacting with that family. You never really know how someone's going to influence your life and help you choose your career path. So because of a little boy that I met when I was in training. When I meet a patient for the first time, what I'm really looking forward to hearing is the patient's story. I'm kind of old school. I like hearing everything myself. I like to hear what has happened to that child. So primarily, a patient's going to tell their story with their parents. And then from there, we'll talk about things that may have occurred in terms of testing previously. And then together as a team, we'll come up with a plan of care where to go forward so that we can help restore health. The joy of pediatrics is that you're taking care of two patients at once. You're taking care of the child patient or teenager in front of you, but you're also taking care of the family as a unit. And so that's why I love pediatrics, because you have multiple patients at one time and you're working together as a team to solve that child's issue, but at the same time helping the parents with their child. I love seeing my patients smile and seeing families smile. Sorry, I get emotional with that because it's really important to me. It's knowing that my patient had a chance to tell their story comprehensively, be heard and listened to fully, and that they're going to have a plan of care going forward to help them recover their health. Medicine and being able to practice medicine is a blessing, and so I think Avera really touches upon that in your daily life. So I think it's kind of living that health ministry that's important. Outside of the hospital, I love spending time with my husband Peter and my family. Baking, I love baking just about anything you can think of, and I love doing home improvement projects. So I try to stay busy.